Do you remember the last video I posted about nursing profession? Yes, that one. The best nursing specialties of 2025. Well, I got so many comments about how nice the video was and how helpful and informative it was. I decided to do an updated version. If you're new here, welcome. My name is Nkem. I do videos on fashion, beauty, lifestyle, and sometimes on nursing because that is my profession. And today, we're back on the video on 5 nursing specialties that are interesting. These are my top picks again for 2025. Let's jump into the video. Before we start off, I just want to put a disclaimer out there to say again, these are my opinion, my own thoughts, and if you have different thoughts, that's completely fine. These are the specialty that I think are the best and some of the coolest that you'd enjoy working in as a nurse in 2025. There's a criteria for me to pick this list. One, they are one of the highest paying ones that you can attain as a nurse, particularly in NHS, or as a nurse as a whole. Secondly, the flexibility of the job is also quite important, and some of these specialties have different flexibility. Okay, so again, it depends on what you want out of life. If you remember from the previous video, I did mention that for you to choose a specialty, it depends on what you want out of life. Do you want purely clinical? Do you want to be under education? Do you want something that gives you time for you to do 9 to 5, or would you rather do a 12-hour shift and then do 3 days a week and get it over with? So really, it just depends on you, how your life is, and what your goals and aspirations are in this life. Okay, let's jump into this video. Number 1 on my list is site practitioner. I had this conversation with my friend after the first video dropped. She was asking me the criteria, and we talked about how being a practitioner is one of the highest paying jobs. It's up to a band 8, and you don't do much. At least from my own hospital, you don't really do much. There are 2 different groups of site practitioner. There are the ones that manage the hospital floor and its entirety. Then there are the ones that are like the clinical site practitioners that kind of manage the wards, if that makes sense. So to be a site practitioner, you need to be a band 7 because the lowest point is start band 7 and then you progress up to band 8. Your pay would be what the normal band 8 pay would be. The progression will follow as the way band 8 progression would normally follow. So that's it. Site practitioners. Before I forget, it's a 12-hour shift kind of job, and I think they sometimes do twilight. There's a new development in my trust where they are having to do nurse at night in collaboration with a different department. That's a conversation for another day. So it's a 12-hour shift. You still get to do your 3 days a week or 4 days a week depending on your schedule. You can opt to be part-time. A lot of people who I've seen that have gotten the job have gone from a band 7 to transition into that as a band 7, and again, they would typically want someone with experience, but this is the kind of thing that you would go and shadow, find out what their day-to-day is, do a couple of shifts with them, and yeah, you learn as you go. So yeah, first on my list is site practitioners. Do you need any other qualification to become a site practitioner? I don't think so, but you'd be expected to have management or managerial qualities to be qualified to do the job. You're expected to have a degree, you're expected to have a master's, or be willing to even get a master's. I think that's the level that you're expected to have. I don't think there is a special qualification or certification that you need to have for the job. Number 2 is ACP. ACP is Advanced Clinical Practitioner. A lot of ACPs are from a nursing background. You can also have ACPs from other health backgrounds. This is one of the highest levels. It's not the highest, but it's one of the top levels that you can get as a nurse. Most ACPs are clinical background, so you have to be of clinical background and primarily acute care. If you have experience in ED, in respiratory, and in acute setting outreach, intensive care, would generally qualify to, go through the ACP route. I think that it depends on the trust that you're working with. Sometimes you get the sponsorship to do your masters, do your dissertations and whatever while you're doing the job. It just depends. You can definitely negotiate a better deal or partnership with your trust if you have a good manager that is willing to help you and lead your case. Then yeah, you would have that, but it's definitely something to consider. We have a lot of ACPs who work in ED A lot of them work in SDEC areas. SDEC is same-day emergency clinics. They manage patients. And I think there's a certain level of autonomy that they have in the job. There's a certain level of things that they're expected to do. And they go as much as prescribing, but non-medical prescribing, if that makes sense. You can have an ACP prescribed like paracetamol or ibuprofen, but wouldn't necessarily be able to prescribe antibiotics, if that makes sense. They have a certain level of autonomy. They're not allowed to do everything. I think ACP is a really cool job if you're very interested in clinical and you're very interested in having a little bit of autonomy in what you do. It's definitely a route to explore. It's a 12-hour shift, again, with day and night shift. So typically you work 3-4 hours a day. You have more training and more experience than a regular person or a nurse in the hospital. So you're expected to see patients, you're expected to clock patients, document, you're expected to have differential diagnosis for patients when you see them. You're expected to have a conversation with your consultant and manage a patient's plan while they're in the hospital. So they work very close with the doctors, but they still work under a named consultant. One interesting thing to point out is in my trust, I think there are some procedures that you have ACPs do. So things like lumbar puncture trainings. In the recent times, I've noticed that we've had ACPs being trained to do these kind of things. And I also was privileged to be in a conversation where we were debating to raise if ACPs are expected to do chest drains. Obviously they're expected to do NIVs, which is fine because it's like a nursing background thing, and that's fine. They're exposed to getting more skills and doing more training than generally getting or learning more, if that makes sense, because they handle and they manage more. So that's something great to bear in mind. The next one is very popular. Became popular during COVID is a travel nurse, popular in the US, but also it's something here. I don't have a lot of information about travel nursing and how you can become a travel nurse here, but I reckon it's similar to being an agency who's willing to travel to do the job wherever the job takes him or her. I had a conversation with a friend of mine whose sister, an agency travel nurse, who in her career she would literally go from London to Wales, to Northern Ireland, spend 2 months working in these hospitals for an agreed fee for that period of time, and the fees are usually high, so they cover wherever there's shortage. Again, it's interesting. There's a lot of money in it. You make a lot of money. The downside is you're always on the go and you're always moving around. You should always be ready to pack a bag and be off. Again, it's a 12-hour shift kind of pattern because you're working in the hospital. They can literally put you anywhere. So it depends. If you're very particular on where you like to work or where your expertise is, you might have a bit of a throw up. For example, if you're used to having medical patients or respiratory patients and you then go to this different place and you're asked to manage oncology patients and you don't really have a lot of experience in doing that, you would struggle, if that makes sense. Again, pros and cons, you earn a lot of money, but then you get moved or you decide to move. Because ultimately, it's your decision to go from one place to the other. You're not being forced, so that's that. But that is an interesting career path to explore if you're interested in that. And the fourth one on my list is a nurse anesthetist. This is one of the highest paid nursing specialty and level that you can get in. The highest level you can get as a nurse is a nurse consultant. I can talk about that and different specialties where you can get to a nurse consultant in another video if you're interested in knowing that. Nurse anesthetists basically work with patients who they need to manage their airway, so particularly patients in theaters or who are in emergency situations whose airways are compromised. So they are trained and they've probably worked with other departments to solely manage patients' airway. To work with IT consultants. Most IT consultants are anesthetists anyway. Work with ODPs, scrub nurses, theater nurses. Their thing would be theater generally. It depends on where you are. Obviously, different hospitals have different ways that they run departments or even when you work. So, for example, my hospital has 2 sites. One site is weirdly different from the other side, and not just in terms of the way the hospital looks, down to the way some things are done, the culture, the learning style, the learning environment. They are all different. Nurse anesthetist is an interesting job. I think that the pathway is still going to be 12-hour shift or 10-hour shift, depending on how the theater runs. So it depends on where you're working and how the theater rotas are scheduled. You can have short shifts of 10-hour shift. You can have a longer day shifts of 12-hour shifts. It just depends on how your department designed their rota to fit whatever the patient. So you do need qualifications to become a nurse anesthetist. There's a lot of competence that you have to do to get to that position, but it's definitely something that you can explore. Ask a lot of questions to the people who work in theaters or operating departments. And by the way, I recently learned that ODPs are completely different from theater nurses. A lot of ODP means operating department practitioner. A lot of ODPs don't necessarily have a nursing background, but a lot of nurses would go into being an ODP. Does that make sense? Just need to put that out there. And also within the theater, of course, there are like scrub nurses and theater nurses. Depending on where you are, you have people, if you're talking about obstetrics, you have midwives, delivery nurses, and that. You also have anesthetist associates, which I have come to recently know about. It's not a doctor pathway, but they work very close with anesthetists that work in theaters, if that makes sense. So yeah, that's that about nurse anesthetists. Obviously, they earn more. They earn a lot of money. It's a very long route to get to that. You spend years and years and years and years in learning and doing a lot of clinical work, a lot of educational work to get there. So for you to make that decision, be sure that you have the time, you have the patience, and you have the perseverance to get through the hurdle to get you there. Last on my list is one of my favorites, which is CCOT. CCOT means critical care outreach nurses. These are nurses that are one of the highest level you get in nursing care, not just in terms of pay, but in terms of experience. A lot of CCOT nurses are experienced. It's an interesting job. You get to see a lot of things, have the pros and the cons. For you to be an outreach nurse, starts from a band 7 position. You need to have ITU and courses done. You need to have your competencies, at least for basic IT competencies, and you should be willing to have your masters or at least do your masters to be an outreach nurse. Outreach nurses don't particularly have work in a ward, but they then tend to manage all the acutely ill patients in the entire hospital. So depending on the hospital and what the schedule is like, they tend to, or whatever kind of determines what the outreach nurses manage at the hospital. Some hospitals that have hospital at night nurses, which I came across one day, seemed like an interesting job. They sort of relieve the pressure of the hospital, especially during the night time, and they manage medical emergencies and stuff like that. So I feel like outreach nurse is a very cool job to have. If you're interested in clinical, if you're very academic, you would love to work as an outreach nurse. You're not tied to the bedside things in nursing, and you're exposed daily to different interesting cases in the hospital. You work very closely with ICU nurses, ICU doctors, ED nurses. They help, a lot of patients, especially like in emergency. And the thing is, from a sim point of view, every time I do simulation and I debrief and I talk to undergrad doctors or, multi-professional colleagues that come in to do one of our courses, I always tell them, if you're in an emergency and you need help, outreach nurses are one of the people that you need to call because they know a lot, and they're always, if they're not busy, they will definitely come and help you. They know a lot, you can rely on them. If you're not getting a lot of answers from a lot of people, they're your next best thing. If you don't have any doctors available, they're your next best thing. Utilize them as much as possible. So yeah, I feel like, it's a very nice specialty, but again, it's something that if you're looking to go through that route, it's something that you need to plan on time. If you start working in the UK as a band 5, depending on where you are, you can move from your department to ITU. This is the best way to get into that route. Move from wherever you are to ITU. Do your ITU courses. You can work as hard as possible to get to a band 6, an ITU system. If you do that successfully, you can then apply for a job as an outreach nurse to, get into outreach. This is the only way that I have come to realize that you can become an outreach nurse. Obviously, some hospitals would have 1 year secondment position, like my hospital would do that. My friend did that. It was absolutely incredible. She loved it. I loved it. It was nice. But the only thing is, if you don't have that ITU course competency, you're not going to be able to get the job as an outreach nurse at band 7 level. That is not to say that there aren't hospitals that would train you as a band 6, help you get the competencies, and then you move up to a band band 7. I haven't seen any hospital that does that. It doesn't mean that they don't exist. I just haven't seen. Okay, I hope this video has been as informative as I hoped it would be. If you have any more questions, if you're interested to talk about more specialties in nursing, or if you want more information on different specialties in nursing that are interesting, please leave me a comment and I'll do another video on that. Okay, until next time, bye.